Hi, I'm Dr. Brittany Dixon. I am a board-certified cardiologist at Heart Health Specialist here at St. Luke's. I earned my medical degree from Harvard Medical School, and from there I did my internal medicine residency at Duke University Hospital, and then afterwards I did my cardiology fellowship training at Barnes-Jewish Hospital under Washington University in St. Louis. I was always kind of a geek. I liked math and science, but it was really clinical exposure that kind of pushed me toward medicine as a career choice. When I was in undergrad college, I actually volunteered in a sickle cell unit with kids, working with kids, but I got to see both the clinical side of medicine as well as the human side of medicine, and I thought that was a cool thing to bring together. So my interest in cardiology really began in medical school. Even before we hit the wards, I instantly thought that the physiology, the pathophysiology, all that just made sense to me, and it clicked. I was a engineering undergrad major, and so the heart's a pump. It makes perfect sense. And then when I hit the wards and I started doing rotations, it was my favorite rotation. I worked with some great cardiologists who were great role models and mentors, so it was kind of a natural fit for me. My specific specialty interest is cardiac imaging, so anything that involves the diagnosis and treatment of cardiac disease, and particular focus on valvular heart disease. Fortunately, we have lots of different new procedures and treatments available now, and we're always advancing, and imaging is very complementary to all of those new technologies that we have. I'm originally from the Midwest, so it was a good fit, and I hear great things about St. Luke's. It's a smaller hospital than where I came from, but I think we have excellent quality physicians here. We have great resources, and so it seemed like a great fit. How I approach patient care is I think of the patients as, what would I do if this were my family member? Use that same type of compassion you would have with someone who's your family or your friend. Think about what it's like being in their shoes and what they would want to know, and how would they want their doctor to treat them. I hope my patients would think that I'm thoughtful but also caring. I want patients to feel comfortable when they come to see me, that they're being seen, that they're being heard, and that that I'm really taking the time to address their concerns. I actually like college football a lot. I had season tickets all 4 years in undergrad, so people usually don't think of that when they meet me, but I really do like football, and my favorite team is the University of Michigan Wolverines. My biggest goal is to reach all populations of people. I know there are definitely subsets of the population where they go to doctors regularly, they know when to recognize their symptoms and get help. But I think there's a huge portion of the population that doesn't have the education or just the awareness or feel comfortable going to physicians. And so I want to help bridge that gap, so anyone who needs our help or who we can help will come in. One of my favorite things to do is travel. Obviously, I haven't done much in the past year, but I just like to be a tourist, explore different cultures, and I think traveling has really exposed me to other cultures, different ways of life, and helps you get a perspective on things. Oftentimes we get stuck in our bubble and we think that this is the way it is everywhere, and then you go other places and you're like, oh, okay. And I think it also helps me to relate to people who I ordinarily would not have anything in common with. You're like, I feel like I have a more open-minded approach to things, and I'm always willing to learn from other people. I think there's a lot that we can learn from each other.